and we'll be together at Nigeria for the implications of health. Let's start with the definition of a pest. A pest is any animal, plant, or any animal plant that is detrimental to human or human concerns, including crops, livestock, and forestry. Or we can define it as any organism, whether it's bacteria, fungi, plant, or animal that harms human health or economics, such as food. So anything that affects human being either directly or indirectly, we will classify it as a pest. And these rodents and many insects are found in household surroundings, and among the major pests that really are actually affecting household environments. And they're also considered as vectors, as they transmit many diseases. And when we consider a vector is any vehicle or means of transportation by which an infectious agent is transferred from an infected person or animal to a susceptible host. We can give an example like mosquito is a vector because it transmits plasmodium, which causes malaria in human beings. Okay, let's start with insects. Insects have also, despite all the negative effects, they have some advantages as well. With advantages, they help maintain balanced insect population because some insects eat other insects, so it helps maintain balance of the population. Insects attack weeds. But also some insects are
recording in progress.
Also, lastly, they use that good decomposers and hence help in increasing the fertility of soil. Coming to the disadvantages, insects, they attack crops and cause economic damages. As when they attack the crops, they cause food loss. So hence, it's economic damage, especially for farmers as well. They destroy furniture and other household appliances. And some people are phobic to insects, and as when they see insects, they get terrified or afraid. So hence, causes some psychological effects. They actually are nuisance to human beings because actually they are actually annoy our environment as well, and also they're involved in disease transmission. So,
sorry, madam.
Yes.
Can you volume up, please? We do not hear you.
You are not hear me?
Yes.
Okay, I said that they are involved in disease transmission. Okay, these are the disadvantages of insects. Okay. So far, in terms of the advantages and disadvantages, we're clear on that. Okay. Coming to the next part, it's about rodents. Rodents are also types of pests and mainly include animals such as rats, mice, in which they cause so much distractions in both our households. And some of the main methods of controlling rodents in our house include rodent trapping. Rodent trapping involves the use of traps, like you when these what we call the mouse traps. We can use them to trap the mice or the rats. Rat proofing means making barriers at homes. In case there are holes at our houses, we use these barriers so that we can avoid their entering into our houses. Another thing involves starving of rodents. When we talk about starving of rodents, it means we make sure there are no food available for rodents to eat. So in case we have stored food, we make sure we store them nicely and safely, package them properly so that there are no food available for them to come to our houses to consume. And the last method, in case they're already at our homes, we can use methods to kill them. For example, we can physically beat them up with a stick, or in case you see they have made some holes in our houses, we can suffocate them or block their holes, or use fire, or in rodenticides, and some chemicals specifically for killing these rodents. Are we clear so far?
Yes.
Okay, now coming to vector control in rural areas. As we said, vectors are any organism that transfer diseases from an infected person to a successful host. So there are various methods that we can use in our environment in order to control vectors. Let's start with the main. We'll just give example of some few vectors, starting with house flies. As you know, house flies are they're one of the vectors that spread cholera. So how can we prevent household flies and how can we control household flies in our environment or in our households? We can use the main method of controlling household flies is actually personal hygiene. That's the main thing. For instance, over here, if you can look at all the points, when you look at them, all of them actually aim at personal hygiene. For instance, all refuse must be properly disposed. Here is the main thing is personal hygiene, ensuring our household surroundings are kept clean all time. Here it's also household hygiene. The house must be kept clean, all food and leftovers should be kept covered. Food vessels and utensils must be kept clean. Food should be protected from flies. The village streets, roads and other public areas should be kept clean. And lastly, people should always wash their hands when using the latrines before and after preparing food. Coming to another vector with mosquito. Mosquito, is among the major vector, which especially female Anopheles mosquito is the main vector which actually deals with the transmission of malaria. So what are the main methods that we can use in order to prevent the breeding of mosquitoes within our environment? The first one is drainage. When we talk about draining, means draining holes, ditches, to prevent the accumulations of water within our surrounding. Or we can fill, instead of draining this water, or we can also fill the holes and ditches so as to prevent the accumulation of water. So when you do that, it means we're preventing breeding sites for mosquitoes. Another thing is clearing bushes, grasses, and long banks in the village as well. So the main aim is to prevent having harbors that can make these mosquitoes have an area to breed. Another method is collecting and disposing containers that are likely to hold water. These include maybe tins, coconut husks, to make sure we dispose them properly in order to prevent having breeding sites of mosquitoes in our environment. And also, sleeping and talking rooms should have windows screened with mosquito-proof wires. So windows should be screened with mosquito-proof wires in order to prevent the entry of mosquitoes within our households. And also using mosquito repellents before sleep in order to prevent mosquitoes from actually biting us. And the last thing, using insecticides, so we can actually kill existing mosquitoes within our environment. Okay, before we move to the next section, are there any questions concerning insects or rodents and pesticides in general? Hello? Any questions, or we've all understood this section?
No question, madam.
No problem. Okay, let's come to the main part of the lecture, which is health services in Tanzania. So, what are health services? What is the health system? Health system defines all activities whose primary purpose is to promote, restore, and to maintain health. So any activity which we do with the primary aim to promote, restore and maintain health. This we consider it as a health system. And actually recently the definition of the purpose has been further extended to include the prevention of also household poverty due to illnesses, because poverty sometimes can lead people to make actions that can lead them to get illnesses. For instance, using dirty water and stuff like that. So when also improve the living standards of people, it helps to improve their health as well. And actually many factors outside the health system helps people's health, such as poverty, education, infrastructure, broader social and political environment. Actually, what we're talking about here, that health is just, it goes beyond just health. You cannot say you're trying to improve people's health and you just focus on solely the health sector. We actually say health is actually multi-sectoral. In order to promote health, it should be intersectoral. That it means you include different sectors such as water, you include infrastructure, you have to include education. All these together, when they incorporate together, that's when we can improve the whole health system of people. Because as I said, health is actually very broad. You cannot just improve health by just focusing merely on the health system. You need other systems too. We actually need other systems to supplement the actions that needs to improve health. For instance, as we said, education. When you improve people's education, when you improve people's health, when you improve the infrastructures, you can help improve people's health. When you improve availability of various social services, also apart from health, it means like water, availability of clean and safe water. All these together interrelatedly will help improve health. Okay, so let's come to the health system functions. The health system has actually 4 main functions, which is health service provision, health service inputs, stewardship, and health financing. So we're going to go deep inside to understand what are the meaning and of each of these 4 functions of the health system. Starting with the first, stewardship. This function involves overall sight of the health system. It involves setting policies and priorities and institutional frameworks for how the system operates. So when we're talking about stewardship, it's actually the policies that we put in order to improve health. For instance, the Tanzanian policy has kept its priorities in terms of nutrition. What are the main priorities for Tanzania according to nutrition? What are the food safety priorities? So all these govern how the health system in general will work. So it helps also in monitoring the trends and planning for the future. It helps in generating and also using data for decision making and also controlling epidemics. When we talk about controlling epidemics, it means controlling diseases. So in general, stewardship, we talk about leadership. In short, it means leadership. So in leadership, it means making policies and priorities that aim at improving people's health. Are we clear?
Yes.
Okay. When you talk about the second function of health service provision, the second function of the health system is health service provision. So this is what actually we see about the health system. Because when you go to the health system, the main thing we go maybe to the hospital is mainly to get treatment. So when you talk about health service provision, it actually includes treatment. Yes? Pardon? Who's talking? Okay. When you're talking about health service provision, this is actually the visible part of the health system, which this involves treatment of diseases and also preventive care such as immunization, health education, child health clinics. All this includes health service provision. I believe this is clear. And the third part of the health system is the health service inputs. So this actually involves all the things that are needed in order to achieve health, in order for us to ensure that people are healthy. So here we involve the human resources, actually the people who are engaged in providing the services, such as the doctors, the nurses, the community health workers. We involve the medicines and the vaccinations that are used in treatment of the diseases. It involves all the medical equipment that are used in treatment of the diseases. So these health service inputs are all the resources that are needed in order to achieve good health. So here, as I said earlier, we include human resources such as doctors, nurses, and community health workers. We involve the medicines and vaccines that are going to be used to treat the individuals who are sick, and also medical equipment that are going to be used, for instance, like blood pressure machine and any kind of equipment that will be used in disease treatment. Or we can say, apart from disease treatment, or disease screening as well. And the last part is the health system financing. So this focuses on all means and measures used in order to raise money to achieve the health. So for instance, revenue collection, for instance, taxes, insurances. So these are all methods that we are going to that are used to finance the health system. So for instance, when you pay taxes, it helps to finance different health services to be given, and the main goal of this health system financing is to ensure that there is equitable and suitable access to healthcare for all people. Okay, so on this part means I'm already done about the functions of the health system. Are we clear so far? Are there any questions before I move forward?
Madam.
Hello?
Yes, we're clear, madam.
We're clear? Okay. So we're going to go to another part, which is the structure of health services in Tanzania. Okay. I want to go first to the last slide. The health service, this is a diagram showing the structure of the health services in Tanzania. So you can just get a glimpse of it, and later I'll come to explain each part on what each level deals with. Okay, starting with the first level. The first level is community health services. So in community health services, it deals with individuals and families who are responsible for maintaining their own health through good hygiene, nutrition, and prevention. So actually in this system, the community is one which is actually involved in solving the health problems using local resources. But there's a community health worker that acts as a bridge between the community and health facility. So actually the main goal of the community health worker is mainly to provide education to the community about various issues about health, so as to help the community, or we can say to empower the community in order to improve their health. For instance, you can say community health worker in Dodoma may teach mothers about exclusive breastfeeding and proper child feeding, or another example is the distribution of nets in the community in order to prevent malaria in rural areas. Also educating the community about various health issues. So this is the first level of the health structure in Tanzania, which is the community health service, where the community itself is empowered or given education on how to improve their health. Coming to the second level is dispensary services. So dispensary, I believe we all know what a dispensary is, right? Because I believe in wherever each person stays, whether there's a certain dispensary nearby that they can reach in order to get health services. So when you talk about dispensary, a dispensary service serves about 5,000 people, and it's usually at ward or village level. It provides mainly outpatient services. I'm actually being straight on these outpatient services because nobody is allowed to sleep or to provided inpatient services in a dispensary level. A dispensary is not allowed to provide inpatient services to people. So it just provides outpatient services. When I talk about outpatient services, means you go to the dispensary and then you go back to your house. You cannot be allowed to rest at the dispensary. So the basic services it provides also provides maternal and child health care, such as RCH, and it can provide simple diagnostic services. Okay, it's usually the first place the patient goes to when they are sick. Okay, example, treating malaria, respiratory infections, or minor injuries. These services can be done at dispensary level. Providing antenatal care and immunization to children. This service can be done at dispensary level. Or a child with fever in a village in Morogoro is taken to a dispensary for testing for treatment. But if the condition is severe, that's when the child will be referred to a higher level, which is the health service, the health center services. So far, this first part is the dispensary. This second level is dispensary, which you said it serves 5,000 people. Coming to the next level after dispensary service is the health center services. When you talk about health center, this one is much more bigger compared to a dispensary. It serves a wider group of people, such as 50,000 people at least, and provides both outpatient and inpatient services, such as delivery services and basic laboratory testing. I previously said that dispensary does not provide any inpatient services. So the first level where an individual can get an inpatient service is the health center services. And it acts as the first referral from the dispensary, and they supervise them as well. So the health service centers are the ones which supervises dispensary. And example of treatment, you can get normal delivery and some complications, admitting patients for conditions such as pneumonia and dehydration. So this is what the health centers actually do. Are we clear so far about the difference between the health center, dispensary, and also community?
Yes, madam.
Yes, okay. Madam. Okay. So after that, if the case is very severe, a person will be sent to the next level, which is the district hospitals. In each district, there's a district hospital, so they provide more advanced services when compared to the health centers. These include surgery. They also provide emergency obstructive services such as C-section, and act as a second referral level from the health center. So when a person comes from a health center, they'll be referred to a district hospital. Okay, and those who provide training and supervision for lower facilities. These lower facilities that we're talking about are the health centers. And examples, as I said, area of the kind of deliveries that they do, example, they can do a cesarean sections for complicated deliveries, which cannot be done at the health centers, treating severe conditions such as severe infections, trauma from road accidents. As we said previously, in the health centers, it does minor injuries. So when you talk about the district health service, it's much more advanced when compared to health center. For example, we can say, can anyone give me an example of a district hospital near where they stay? Hello? Hello? Okay, let's move on.
Yes, madam.
The next level is the regional hospital. So these provide specialized services such as internal medicine, pediatrics, surgery, gynecology, and they receive referrals from district hospitals. Okay, they also conduct training and research to support lower facilities. So because they provide specialized services, these hospitals always have specialists. They have various kinds of specialists, such as pediatrics, they have surgeons, gynecologists, in order to provide these services. They can manage more complex conditions such as diabetes, severe hypertension, advanced infections, and any patients that comes from a district hospital may be referred to a regional hospital for more specialist review. Okay. And the last and final stage is the national referral and specialized hospitals. So this is actually the highest and really highly specialized doctors with advanced equipment. They handle very complex and rare conditions. They provide specialist training and advanced research. An example of a national hospital and the referral hospital in Tanzania is Muhimbili National Hospital in Dar es Salaam. And these other referral hospitals provide treatment for cancers, brain tumors, heart diseases, and complex surgeries that cannot be done in referral hospitals. Okay, for example, another specialized hospital in Tanzania is Milembe. So we know that Milembe specializes in people with mental health issues. So in case any hospital has a person with a mental health issue that is beyond their reach, they will refer that specific patient to Milembe. Or in case a hospital has an extreme case of a patient with cancer, they may refer that specific patient to Ocean Road because Ocean Road is specialized in cancer treatment. So all these that I just explained are the levels of hospitals in community services in Tanzania, where we said the first level is community services followed by dispensary, then health centers, district hospitals, regional hospitals, and finally national hospital. So as we advance to each stage, also the level of expertise increases, the level of complexity of the cases that they receive is also higher. So that's how the structure of the health system in Tanzania is. And with that, I'm actually done. I don't know if anyone has some questions because I feel you're so quiet. Any questions or you understood the lecture? Hello? Any questions?
No questions.
Clear?
It's clear.
Very clear.
Clear.